Okay, I'd like to welcome everybody to the Commission to Study Costs of Special Education. That clock on the wall is not accurate. It's a different time zone. We should all have, before we get into the meeting, there's two pieces of paper you have here, two bundles. One has the minutes of the last meeting, which was December 19th, 2025, which we'll go through and address. And the other is a packet of materials which has the agenda on it and which we'll be jumping around through this agenda. And so if you don't have both of those packets of materials there, let us know. We have lots around the table here. And so with that, I'd like to go ahead and open up the meeting for today and call to order. And the first thing on the docket is to approve the minutes of the last meeting, which we had December 19th, 2025.
So move.
So we have a motion made by Representative Freeman and second by Representative Ames to approve the minutes of December 19. Does anybody need a little bit more time to look them over? Are we all good? All those in favor, say aye.
Aye.
Opposed? Thank you very much. For the record, that was unanimous.
Is there any abstention now? Yeah.
No, I don't think, I saw everybody's mouth move. Okay, so now what I'm going to do with this information that you have here, looking down at the agenda, I've received some communication from some of our members during the last several months here, which we have been now engaged pretty heavy duty on various legislation coming in, dealing with the cost of special education. So now we have an opportunity to speak to that a little bit. But going down through where it says information and handouts, the status of legislative performance audit oversight reporting for both the EFA and the special education programs. I did communicate with folks over at the LBA and asked, what is the status of these two reports, one for special education, one for the EFA program. And I put in quotes right there underneath that. And also you'll find if you look at this, flip over the next page, you can see a communication from Jay Henry. Jay is the supervisor of performance audits at the LBA office, audit division. And he's basically said, for the oversight of special education, the audit team has completed 34 of the 71 planned observations. And this is effective of February 2, so it's about a month old, a little over a month. The LBA hopes to have a full draft report in the second quarter of the year 2026 and final report in the summer 2026. That's what is projected out. I've heard that projection before. Yeah, on that one right there.
Just a quick update. I believe that the Legislative Performance Oversight Committee did meet one additional time since that date. And having been at that committee meeting, I believe they said there are about 80 observations and the report is currently about 800 pages.
Yeah, I've heard it's a real textbook with chapters in it.
800.
800 plus. I've heard the same thing. The second report, the New Hampshire Education Oversight of Education Freedom Accounts, the audit team has completed 22 of the 44 planned observations. The LBA hopes to have a draft report by mid-spring 2026 and a final report in the summer 2026. So none of those reports are completed at this time. Although when we do get that first report, it's going to be a chore wading through it. Okay, going down to the next part, State of the State Special Education in New Hampshire Economics Lab. We've received that before, but it had some information which we'll be addressing as we go through here. Several of the questions is what's driving these costs, which we will talk about. Improving, can we help out with the special education services we're delivering by maybe even looking at what's going on in the regular classroom and see if there's more reading instruction going on that could help these students in looking at learning style and teaching styles and all that. And the quality of overall quantity of staff to better support learning while containing costs. 47% of the special education budget is made up of paraprofessionals. 47%, and that was on that report. We'll look at that a little later on today too. There was another report which I got from the, I'm sure many of you may have seen it. It's called K-12 Kindergarten through 12 Dive Referral Rates. I got that from Rebecca Fredette. I also had seen it earlier. Special education enrollment keeps growing. These three graphics show how autism, developmental delay, and multiple disabilities mark the fastest growing IDEA disability categories between 2023 and 24. That's in the country. And so we'll discuss that a little bit. Other health impaired, the definition of other health impaired, also this information came from Rebecca. 20% of our New Hampshire special education students are labeled or categorized in that other health impaired category. The last one, E on that page, intervention policy. I mentioned years ago, or not months ago, that I had done an intervention process as a school administrator. I just attached that particular policy into this packet of materials. I believe that intervention is something that's key to our looking at how we can help the special education numbers, which we have. And I also on F, on the second page, the annual report from the HHS regarding MTS. That's the Medicaid to Schools report, which was sent out to the President of the Senate, the Speaker of the House, and to various committee chairs. That report is also included in here. We will also address it when we start talking about some of the Medicaid to Schools information. And the interim report of the Commission to Study Costs of Special Education 11/1/25. That was the report that we're required to submit at the end of every year. And that's the report which was sent from this. It basically explained what we did in the first three meetings, which collect a lot of data. We didn't make any recommendations of any kind. So with that, I'd like to look at what's under new business. I'm kind of rushing through this because I'll come back to these items. But I'd like to really jump to the costing of special education aid and give you an update of what's going on in the House in terms of what we're doing with that funding formula. And to start out with here, there's a brief table there which shows a little bit about it, but you can jump to the back side of this packet of materials and you'll find several amendments. Unfortunately, I did not number the pages in the packet here. The first one is the LAD Amendment 1563. That amendment was adopted by the committee and went to the House and came out of the House unanimously and went on to Division 2. And while in Division 2, there is an amendment put forward just last week, or was it the week before? It's all last week, yes. And that's Amendment 1086H that was put forth by Representative Urf in Division 2. And we will discuss that amendment too, seeing that that amendment is basically replacing the amendment which came out of the House Education Funding Committee. Going back to the Education Funding Committee amendment and that table and doing a comparison of what these two amendments do. We've struggled with, as we all know on this commission, we've tried to identify if we drop the present formula where we start, remember, at 3.5 times the average per pupil cost, the cost is approximately $75,000. If we just use the figure we usually have been using, $70,000, that way it's $20,000 for every one. And we've struggled with that, seeing that when we're trying to back off from the 3.5 and going down to 2.5 or 1.5 or whatever it may be, it's hard to determine what type of numbers we're talking about as we get closer to that 3.5. And that's a struggle. In fact, the department does not have that information. That's information that's available at the local districts when they submit for special education aid, which starts at that 3.5 times the average per pupil cost. They have to send in with that the information that backs up that all their claims, all their invoices, which accounts to the 3.5 times. So they can start receiving that 80-20% split going forward up to 10 times. What the amendment did for the House, which we passed, we discussed this a long time, and we found that it's basically impossible to calculate using every bit of mathematics we had, even calculus, trying to figure going back from 3.5, dropping it down to 3 or to 2. In this case, we used a round number of 50,000, 40,000, 60,000. We went away from the 2.5x to actually an average percentage, average dollar amount for that amount. In 1563, 0546H, that's our amendment from the House, we have from $0 to $50,000, the local remained responsible for 100% of the costs, up to $50,000. Then, after hearing much discussion, and Representative Ames, you were part of this and you heard it as well as I did, that we could not determine, let's say, from 50,000 to 60,000, how many students that involved, and what would be the actual cost. The idea was to try to do this incrementally, to try to determine as we backed off down until the department can get a hold of these figures. And that would include a whole change of their capturing this data from the local school districts. So between $50,000 and $60,000, 90% of that change, that $10,000 between 50 and 60, 90% would be the responsibility of the local school district. 10% would be the responsibility of the state. The idea was perhaps if we offered a carrot in there, we might get more information. The carrot would be that $1,000 out of the $10,000. And in looking at that, it's really not enough of a carrot. I don't think folks that are in these small districts would chase that $1,000. From $60,000 onwards up to $200,000, then the ratio we had before holds: 20% local, 80% for the state. So that's actually dropping it from roughly the 70,000 mark to 3.5x, which we had always used 70,000 as that average per pupil cost. So it would get some more students involved and save some costs at the local level. How much, we're not sure. And going above 200,000, this changed it from 100% of the state to a local of 10% and the state at 90%. One of the other, and that, of course, then that puts in another cost onto the local. Again, we could capture some of that based upon, we know there's basically 890 kids that are receiving from 70,000 or 75,000 upwards. We also had within that bill, after 1 year, the proration would jump from 80% to 90%. So that we were hoping after we capture and get more idea what's going on, we can get closer to the responsibility of the state to pay 100%. And that was the idea, to move closer to that. And in subsequent years, we didn't put that in there, seeing that we just didn't know what the second year of this would be back in 2029. The second bill, 1563, 1986H, which is that of the Division 2 right now.
1086.
Excuse me? 1086, excuse me. It's 1086. It's not 1986. Yeah, 1086. It's a typo error. It's knocked down to 2.5x, approximately $50,000. Up to that point, up to the 50,000, it would be a local responsibility of 100%. Beyond the 50%, from 2.5x to 3.5x, it'd be local 85% and state 15%. And above 10 times, up to 200, it'd be local 10% and the state 90%. And of course, the 3.5 to 10x, local 20 and state 80%. That's, let's see, on the, I don't know what that's in there for, because I think it was 2.5x to 3.5x, 85%, 15%. They did not have any changes to the proration amount. Now the proration remains at 80%. The bill also can contain information regarding Medicaid and private insurances, that those would be chased if they're not available or that money is not available for some reason, whether it's a private person say, I don't want to do this, then the amount would be paid by the state. The amendment that came out of the Division 2. Each district submits certified reporting documents each year on the services and expenditures that they're for the DOE. They had it's quite a process of reporting and auditing. The department shall establish a risk-based monitoring program, annual review of not less than 20% of the districts submitting claims to the state, with all districts reviewed every 5 years.
Where's this?
This is in the,
Page 3.
What page?
yeah, it would be on the bottom side.
28.
Yeah, I'm not looking at that right now, but I think that's where it's located, Representative Ames. And the audit, there were some questions on that. I raised questions on this. My concern was if there's an audit, who's going to prove the auditor? Is it going to be a local district going out and say, Susan Jones, will you audit this? I was suggesting that the audit be approved by the Commissioner of Education. But at any rate, that is in there. And there was some discussion whether the districts are audited or student IEPs are audited. And so that's basically, in a nutshell, what's happening with these two proposals are coming forward. I'll open it up to discussion right now. We can be looking at those. Representative Ames.
Yes. Do you know whether there is, I guess it would be LBA, a fiscal note, a current fiscal note on this new amendment?
There was no fiscal note offered. We asked on that. It's all, as you can imagine, conjecture based upon, we know what it is, starting with that child that might be the $500,000 annual cost child, or $600,000 at the very, very top, moving backward from these 890 kids down to the first, the 3.5x and how much that costs. But then when we were putting this on paper and math, the curve went just straight up in terms of number of students and costs. So we just never saw anything like it. Never saw it.
Follow up, did Division 2 act on make a recommendation on this? I think the voting is tomorrow.
Yeah, that's correct. That's correct.
By the full.
Full committee.
So I'm wondering if
There will be a recommendation coming from Division 2 to move this forward. Then the committee tomorrow will have to address it. Yes.
I guess I have a question. If the LBA has not yet provided an updated fiscal note, is that also the case? Do we assume that finance does not have the same information?
There's not a fiscal note on either one of these amendments. The information is not collected by the department. And the local districts don't submit the costs of a child until it gets to the 3.5x level. And so when we move back down towards 2.5, which we know we got to do, we got to help save some of these costs in the local level, but there's no understanding of what type of numbers we're actually dealing with. And I'm going to leave that up to the mathematicians that are in finance and ways and means and all that to figure that one out. But we worked all summer long and all fall and right through the winter trying to figure this out. And we weren't able to do it. One more, yes.
What
You were there with us doing that.
absolutely. What puzzles me on that? I'm sorry. Thank you. What puzzles me on that is that the original bill, which had a similar structure, very significant differences, but a similar structure, came with a fiscal note, and so a stab was made at estimating the impact of the changes on the local school districts and on the state. So I don't know why we're not, obviously a lot of estimating has to. or
Yeah,
you
and
could
every
call it
time I've asked for
guesstimate.
that, I've seen the word indeterminable
Oh, boy, bump into
in
that
the
one.
fiscal note.
Yeah.
Yes.
Thank you, Mr. Chair. Sorry, I have a couple of questions. Do we have any update on whether or not the new data system that the department is looking into for special education would allow any of this to be automated in terms of pulling some of this information, or is it still going to need to be hand entered by somebody in terms of the students' IEPs?
That's the issue. No, the data system's not available. They have been working on this for 2 years. And rather than going buy one right off the rack or off the shelf, they decided to develop their own. And with that, issues have come up. So we don't have that information. We do know, though, that right now it's paper and pencil, and it's going to take a huge amount of staff at the local levels to be, if you're wanting to input information on, subtract the 890 IEPs out of the 32,000 roughly, that means that you're going to have a responsibility on the local level for these resource room teachers, special ed teachers, directors, whomever, to enter this information into a system manually. And so that would mean additional staff. The costs would just skyrocket.
So can I ask a follow-up question?
Yeah.
So when they were discussing this bill in Division 2, I believe it was just last week,
Yeah, it was.
what is it? Am I remembering correctly that the department said if they were to pass this with this amendment, that they would require 6 staff to process this information? Is that, do you remember?
I heard
as
the
well?
number 6 too, and I think that's it's a number of staff, which is kind of not where it really would be. I think it'd be more than that, but I also believe that we're not talking about the number of staff to put this information into the system at the local level.
Correct.
Which is huge.
So is there still an opportunity for the legislature to be able to influence however that data could be pulled from this new system, or is that system completed?
I don't think the system's completed. Now, I'm just talking from what I've heard. When I spoke with the commissioner, who must have been on this particular topic maybe about 3 weeks ago, they're 2 weeks into this, and the commissioner's indicating that they don't have the information, but they're not getting what we need out of it.
Okay. Because I do think, we currently, a lot of information is automatically pulled out of Nessus, which is the current data system that's being used for special ed. So I wonder if there's an opportunity to mitigate some of your concern about the number of staff hours at the district level, if some of this information can be automatically calculated somehow through students' IEPs that have to be inputted already into the system.
Which IEPs you talking about have to be inputted?
All students' IEPs are currently in the Nessus system.
To what
Every
degree?
student,
To what degree, though? Does
everything that is
claims,
required.
the costs?
Well, there's no cost necessarily right now because we are not requiring districts to input costs for every student. So the special ed aid system is completely different. But I guess what I'm wondering is, and Jen could probably speak to this more clearly, but all students' IEPs must be entered to a certain level into the Nessus system currently. So if this new system is going to be the same, which I would imagine it would, where every student's IEP in the state must be put into the system, I think there must be an opportunity, if the system's not completed, for us to be able to crosswalk some of the cost things that could be automatically calculated to some extent. And then someone at the district would obviously still need to oversee it and calculate and make sure it's pulling correctly. But I don't see why going back to having teachers who are supposed to be providing direct instruction, inputting data into a system seems really counterintuitive to what I feel like we're trying to accomplish.
Jen, do you have anything to add to that? I understand it to a certain level, but the districts are not entering in the cost associated with that IEP. And then being able to show any kind of invoices that are related to that claim.
So just a quick, sorry, Jen. Just a quick follow-up. I'm not disagreeing with that currently. However, there was a document that went out early, I think in January, that listed out data sources for each of the tasks that we've been asked to do on this commission. There are other costs that they're already calculated at the district level for these kinds of services. I think there would be a way to kind of crosswalk what you're asking. I think it would be a change, but I do think, calculating a teacher's hourly rate, for example, we're already doing that for some things like Medicaid to schools. Those costs are available. It's just about making sure the right information is put into this new system so that some of these costs could be automatically calculated, in my opinion.
So the information that's put into the Nessus system is incredibly detailed, right down to the number of minutes that a student is receiving paraprofessional support or related services, speech therapy, occupational therapy. So an analysis could be done. You could look at what number of students are in out-of-district placements, what number of students have paraprofessional support full-time, what number of students receive both OT and speech. So clearly there's predictive ways to analyze that data. Districts do put in costs when they anticipate that a student's going to reach that cap.
And that's 300,000 plus. Sorry, or,
3.5 times the, yeah,
3.5, okay.
past, as he mentioned, currently about 75,000 are what they're anticipating.
Oh, gotcha.
Yes, Representative.
Thank you, Mr. Chair. So I heard exactly what you said. I heard exactly what you said. I heard exactly what you said, and I have a question. We just passed legislation that will require districts to report to us their audits on a yearly basis or face a penalty. Could we not include the costs of special ed at the district level with those audits?
You get that data in the report 25. So the DOE has that data, and it's been published several times. You can analyze. So districts are obligated, and we don't have the business person here today, to report the data. So there is data that there's no reason to do an additional audit.
I understand that, but if they're already doing the data, the report they have to submit to the DOE once a year with their audit, why couldn't they just add that amount with that audit as well?
I'm saying it's already included in the DOE 25.
Okay. It is already included.
Yeah.
Is that data that they're submitting aggregate data, or is it individual IEP data?
They don't put individual IEP data.
That's
They
the
report the
concern.
costs. They can report the costs.
Thank you.
Yeah.
That's what I was thinking.
Mr. Chairman,
Becky Wilson, yes. Becky?
To answer Representative Freeman's question and to sort of piggyback on what Dr. Doloff was saying, I think one of the pieces, and I think in the list of information sources that are available that went out early in January, I don't know if that went to the full committee or just to you and the vice chair and Jen. However, I think part of what would be useful would be to look at where districts are putting their special education costs in their line item budgets, because yes, the DOE 25 is capturing that for districts on a large level. And most districts are using, for example, their 1,200 lines for special education costs. However, as we've discussed a number of times in other committees, there are some services that are provided that may also sort of count towards special ed, like reading specialists, things like that, which might not be completed just in the 1,200 lines. Those might be in your 1,100 lines. But again, I feel like there is an opportunity right now to build whatever system you're trying to get to with this data collection, where districts could input a lot of those things at the beginning of the year. And then some of the calculation pieces that you're trying to get at in terms of the what's 1.5, what's 2.5, those could automatically start calculating, for lack of a better term. I think there is a way to do that if the department is willing to include that in part of this data collection system. It would automate a lot of those pieces. To Dr. Dolloff's point, we're already collecting a lot of this information. It's just about putting it all into one place where the system is doing the majority of that work, and then someone is overseeing it to make sure that, again, to the audit point, that we're not putting in for services that are not allowable or what have you. But right now, humans are doing that. They're going through and saying, was this student at school today? When we cross-reference with the bus list, were they on the bus that day? Okay, that transportation cost is allowable for that one day. I mean, that is what people are doing. And that's why it takes so much staff time. And that is why people are not putting every kid in the system, because you just don't have the people power to be able to look at every attendance list for every single day for every student, and cross-reference whether they left early for a dentist appointment so they don't get their speech that day. Like those kinds of things. That's what people have to do with the students that are currently being put into the system for special ed aid. If there's a way to automate a lot of that and then just have somebody cross-reference to double check, I think that you will get the information that you're asking for, and it won't necessarily take, teachers out of their teaching role to be paper checking a lot of this, which is what we're trying to avoid. I think providing better specially designed instruction and less paper.
Oh, thank you, Mr. Chairman. One of my concerns is some of these, in my experience, the higher cost profiles. I've come across a large number of those where there's compensatory ed that gets earned because providers leave, or the needs are so great trying to find someone to fill that role, a nurse or whatever. And I wonder how they calculate that. If you're looking at the IEP and you're saying the student has speech and nurse and this all year long, and you just calculated that out in advance, and then there isn't a provider, we have a cost that actually doesn't exist, a service that's not being provided, but something we've accounted for in a cost. And it's only kind of recently that the department is really saying you have to put those compensatory ed numbers in, a written prior notice, or actually in the IEP in some cases. But if we were to just say, 800 hours of speech, but your speech person quits and none of that gets delivered the second half of the year, the following year, you owe that. And I don't know that we can quantify it in advance from the IEP. I think it has to be after the fact to know what was delivered and what the cost was, because saying the cost up front as to what it is not always going to be accurate. And particularly, I think, with the higher cost profiles that remain in district. I'll say that, because if they go out of district, we kind of know what it's going to, it's 300,000 or 500,000. But when a student remains in district and we lose that employee, then there isn't services. I mean, I have one right now that literally there's probably 1,000 hours of compensatory ed, and it's nursing. That's a very expensive service.
So if I could just, compensatory ed became a huge machine after COVID, and it started with a few of the dictates from Concord. But comp ed is really, it's not a sort of quid pro quo. You don't miss 20 hours, so you get 20 hours. The intent of comp ed is to make the child right. So if, for example, a paraprofessional is out because they're getting their medical needs met and the student misses 8 hours, you meet as a team and determine what impact did the loss of that paraprofessional have on that child, and how do we make it right for that child. So it's not you don't miss 20 hours and then you get 20 hours. It's also fairly infrequent now. It's not, like I said, right after COVID, the state obligated us to report all of the comp ed and provide comp ed based on services that were missed. And that was a huge undertaking, but it's fairly infrequent right now.
I beg to disagree. It's hour for hour.
I would
that's what
suggest
the hearings officers have ordered.
the hearings officers may, but if you look at the way that cases have rolled, it's always been, it's not one for one. It's making the child right. It's never been providing all the hours that were missed. It's about making sure the student's making appropriate gains toward their IEP goals. And the hearing officers may decide to choose to answer in that way, but that's not the intent of the law.
Well, the new deputy commissioner has said the same thing.
I'm sure.
It's hour for hour.
Who's the new deputy commissioner?
Richard Sala.
Okay.
And so in theory, I agree with what you're saying in theory, that it's to get this child situated where they would have been without the lapse in services. Not
Correct.
But and in some weird case, you might have somebody that needs more, right?
Correct.
They need more to get back
Correct.
to where they would have been. All I'm pointing out is that the comp ed thing in these high, it's frequent that we see it in the high dollar profiles because there's so many more services for those students. And as we know, we like anywhere else, we just have problems with people staying in those jobs, and they leave, and then there's a vacancy. So,
Well, the number of contracted staffing numbers is huge. School districts can't attract people to fill these roles.
Representative Dry.
Thank you, Mr. Chairman. Okay, so someone who doesn't live in this every day, it's not keeping somebody on retainer, it is actually doing the billable hours. Is that correct? And the comp ed is what happens if the person can't show up to do the hours at all.
So there's different levels of comp ed. So there's comp ed, I've sat through hundreds of meetings on comp ed. When they get to a hearing officer, if it's a due process case, it's a different story. I mean, those are the high level situations, and we don't have a lot of those in New Hampshire. But for the most part, if a paraprofessional's out or a speech pathologist needs to take a leave and we aren't able to fill it, there'll be some comp ed. And oftentimes we'll say that can take place over the summer. It can be in addition to the hours they're receiving currently, but we try to make it right for that child and bring them back to where they needed to be.
Follow up. And that would fulfill the IEP.
Correct.
Thank you.
Right. Ensure that they're receiving FAPE, free appropriate public education.
there would be a meeting, and generally speaking, there'd be agreement on that.
Yeah.
So there would be, okay, 10 hours of one-on-one in the summer is equivalent to 40 hours of I'm just rough numbers. So there's usually an agreement on what it would be to get it back. I'm just pointing out that the cost is really hard to predict with the employment situation being
Right.
what it is.
Representative Murray.
Yes, thank you, Mr. Chair. So part of my question is also, obviously we have a staffing issue with our service providers as well, if there's a shortage in that. So when we're talking about those cost metrics getting reported, like Ms. Wilson had stated, my curiosity is why couldn't, I'm not a tech person, why couldn't on the back end of the DOE 25, that information be added to the DOE 25 and then pulled into Nessus 2.0 from that somehow? Is that something that would require legislation to do? Or is that something, I think that's piggybacking off of what Representative Freeman was asking.
Yeah.
Like, is it something that a statute is legislation is necessary for, or is that something the department can independently do through rules or on their own?
How do you see that?
Thank you for the question, Representative Ladd. I think that's really probably a better poised question for either the department or the BA that typically sits on this commission with us, who's not here today. There are, in the DOE 25, it's broken down primarily into, for special education costs, your legal costs, administrative costs, instructional costs, related services. There's a separate piece of looking at individual student costs that are reported for special ed aid. I don't know how those two would crosswalk necessarily. I do appreciate, though, that I believe Representative Murray has a good point, which is, and Representative Freeman, there's got to be a way, especially if all of these costs are retroactively being paid back to the district. I guess that's a big piece of this conversation. If these are reimbursed costs that are happening kind of in real time, that's a different conversation than I think if these are all retroactively being paid back to the district. That would be, you would have time to sort of audit it in this particular way that I think people are talking about, versus we're providing these kind of as we go. So that would be a piece, I guess, of 1563 is looking at, is all of this reimbursement that's happening for districts under these two amendments retroactive the way that it is now, which is a year later you're getting the reimbursement potentially, or is the expectation that somehow this money is being provided to districts more as like adequacy or differentiated aid is now. We're kind of as you go. I don't know what the intention is of this, but I think if you're looking for an audit aspect that is going to be sort of a high level audit, that would need to be built into the thought process about how you're submitting these claims and who's auditing them in real time, or is it, to Representative Freeman's or Representative Murray's point, when you're doing your audit, within 6 months to a year after the close of your books in July, are you then also auditing this information to make sure that allowable things were inputted?
Thank you so much. You just summarized exactly the point I was trying to get to. Thank you. Thank you, Representative Murray.
Yeah, no problem.
Could I ask a clarifying question?
Yes.
So I haven't looked at any of these materials other than just sitting down here now. So it sounds as though because of the challenges with collecting the necessary data, that these two amendments are likely going to be challenging to pass because we don't have the data to clearly indicate what the costs are, right? Is that sort of,
Yeah,
okay,
I think that's fair.
okay. I just want to kind of get a sense of where we're at.
What do you think, Representative Ames?
Well, first, we should recognize that the First Amendment, I think it's the Ladd Amendment,
Yeah.
passed the House already and went to finance. So we flew over the absence of a fiscal note and sent it on to the gurus of finance. And now they've come up with another stab at this with different numbers, different percentages, different requirements for identification of the costs. And again, that's done with some input, as I understand it, from LBAO on the kind of very discussion I think that we're having here. They're ready to vote on this amendment as it stands. And maybe as they sit around the table and start looking at this closely, they'll say, wait a minute, we don't really know what we're doing, and say no, So I think there are serious issues in costing this out.
Yeah.
And I worry a whole lot about the burden on LEAs and what they're going to have to do to get the money, according to this bill, and what the cost is for them. And there's also a cost at the state level to process the documents, the information. So a lot of red flags here. And I say all that, I'm totally in support of providing more help, dollars, to the local education agencies as they struggle with the higher cost, higher end special education needs.
And then Becky, go ahead.
Okay. Thank you very much. One of the things that I also just want to make sure that in this conversation, we're talking about the students who are also then perhaps not getting enough services or are having services delayed. But yes, I think the vice chair is correct. LEAs are struggling with a disproportionate amount of the funding mechanism currently. And I think that when we're talking about the needs of a student, that is obviously the first and foremost of our conversation about what an IEP requires per child. So when we're talking about the needs here, we also have to recognize that is something that the IEP team determines is necessary for a child to make adequate progress and also meet FAPE laws and least restrictive environments. So however we get there, I don't think we can continue to just kick the can down the road. I think we have to continue to press forward, whether there requires legislation, like Representative Freeman said, to direct the department in a certain way, or some other mechanism here. I think we really do have to dig deep here and get that information so that we can move forward.
Well, let me just speak quickly and respond to that a little bit. The amendment which we passed out of the House recognizes that the state is going to have to pay more money to support these high cost occurrence youngsters. And we're just backing it off. We're backing it basically from 3.5 down to a number, whether it's 50,000 or 2.5 or what. If we're backing it down, we know that's going to have to generate more money for special education aid. There is a fine line somewhere in the costing of all special education where high cost occurrence funds, catastrophic aid, step in, and then the other costs, which are not high costs, but they are costs where a child has a specific need, maybe a specific learning disability of some kind, which is not costing what the other does cost. Where is that line? And we've got to back it off. We know that where we have the line right now, it's not sustainable. The local districts cannot do this. My concern is that if we start backing off down into the point where you have a youngster that's getting support in reading, and maybe during a half hour a day, every day per week is getting some reading support, that's not going to cost the level of the other on the right-hand side. But we're going to get down in the business now. We're going to have the local education agency having to report. It's like now the aid's becoming more targeted, and it's going to be one where there's going to be more accountability and more reporting and more managing. And I can remember as a teacher myself, and this is years ago, when we're getting into everything about phonics, whether it was blends, diphthongs, or anything else associated with it, blends and all that. We had to document on a sheet, did this kid have this skill? Boom, knock it off. Yes, no, he knew short vowels. Yeah, okay. Got that all done. We spent most of our time documenting and managing and less time instructing. And I don't want to see this starting to occur in this domain either. So somehow I want to be very careful when we do back off. We know where we're backing off. And we're still maintaining the whole purpose of special education catastrophic aid. I don't want to get into a big management problem and a costing management at the local level. That's going to be huge. That's going to be huge. Back and then Dr. Dolph.
Thank you, Chairman Ladd. So I share your concern that I think, and we've seen it with the Medicaid to Schools program, sort of as, maybe the canary in the coal mine. We don't want to make this so staff heavy that districts don't participate in it because they don't have, what they get out of it is not what they put in terms of staffing and time and things like that. That maybe it's, quote unquote, not worth it. I think I certainly can appreciate, and I think districts highly appreciate the focus that the legislature has had this year on trying to give some property tax relief, quite honestly, by providing more support from the state for special education costs at the local level. I think everybody is very appreciative of that. And I think we just want to be really cautious that we're not putting so many barriers in the way that perhaps districts that actually are losing money, even though they're gaining money, by trying to make this process unwieldy at the local level. Do we have any idea with the LBA audit that's happening now for the department for special ed, how many of those observations might be related to special ed aid and the run of that, how that program is being facilitated through the department? Do we have any idea how many observations might be related specifically to special education aid?
Well, when I sent that request in to them, this is what I got back, the page that you see there. I got no further information regarding anything in response to what you're asking.
Because the last thing I want to do is to kick this can down the road, knowing that there are so many legislators who are willing right now to really try to make this better for districts and for local property taxpayers. I certainly do not want to remove any motivation to try to do something helpful. That being said, I would hate for that 800-page report to come out and for there to be 30 observations about how the special ed aid program is being currently run between the department and districts, and for us to have created a situation where we can't address those. I don't know if there's a way, perhaps, Chairman Ladd, for you to ask the LBA if they can even just give you any kind of idea about what, or the department. I believe the department gets those observations before the report comes out to try to correct them or respond to them. Is there a way to talk with the department just to make sure that we are proceeding down a road that's going to address any of those concerns? Or perhaps get ahead of some of them so that we're making things better as we're moving forward and not creating a more of a mess, I guess, is my concern.
I think that's a good direction. We need to ask that question. Maybe what we need to do is put a small group of this committee together where we can meet with the department and be asking some of these questions. I can remember when Henry Lipman came before, this committee, but also before the Education Funding Committee. And we were addressing the issue of Medicaid to schools and how that worked. And he referenced Colorado. And Colorado, you notice on the second page of the agenda, I have the Colorado School Medicaid Consortium, a little bit of information about that there. But there are states like Vermont, our neighbors next door right now, which are going with what they call a BOSSI, a Board of Cooperative Education Services. I don't know if it's a separate nonprofit or whether it's linked to the department as a separate bureau within. But this, we've been looking at recognizing the costs of doing business administrative wise in this state. It's really costly. And we've been looking at consolidation of SAUs. They've tried that over in Vermont, and it's been a slippery slope. And in fact, I was over just yesterday, on Saturday, looking what happened in Maine, where they had a consolidation of Mexico and Rumford. Now Mexico is building their own new high school again and sort of splitting away from what they had intended to do. So I'm looking at, is it possible to have a board of a cooperative board for just special education services, which is managed by the department internally, which you have your state maybe broken up into 5 different regions like they've done are going ahead in Vermont. So the delivery of services are managed by each one of these regions. So to save some of these costs that we're talking about right here. Is that a direction that we may want to look at? Or are we going to just keep continuing down this old route of 109 SAUs and we're going to try to make this all work internally, which is, it's going to be very, very costly. And we're going to have small districts of 100 kids, 150 kids trying to provide these services. And it's going to mean hiring more personnel. Senator Murray, do you have, I can see you moving here.
Well, I tend to sit here and listen a lot before I chime in.
Yeah.
So I've got a few things, a few opinions to share. One, I really like some of what I read in the amendment. I share your concern about the costs. I can't speak for the Senate as a whole, of course. I don't think that a lot of my Senate colleagues will support an amendment that doesn't have some real hard dollars attached to it. And I know that there's a lot of difficulty in coming up with those numbers. In terms of the SAU consolidation, I've always believed that is necessary. And whether that comes duty by duty, as you're proposing, to start with special ed, that's okay. I mean, I agree that may be a great step. We've looked at SAU consolidation as a legislature back to when I was 5 years old. We were looking at that here, and I've read the reports. I would really encourage anyone to look at the one from 1993, which was just really, it's strange how 30 years later it's still applicable. And of the two amendments, I appreciate the IRF amendment. Excuse me. Yes, the IRF amendment a bit more than yours, Mr. Chairman, no offense to you, because it does a good job of attempting to prevent districts from being incentivized to label children. I've got one of my towns that 30% of the children are labeled special education. That's just not reasonable. Why is there such deviation from town to town? And I think that whatever we recommend for legislation really has to take a good look at finding a way to ensure that districts aren't being incentivized to label children and keep them labeled. I have 3 children currently in one of our state school systems. And I will tell you from experience, once a child is labeled special education, it's extremely difficult to have that label taken away because inertia is strong, especially when you're paying a district extra money for it. And the more money we give districts, and I share your concern and I share your belief that we need to do something about this problem, but the more money you're giving them, the harder it is going to be to correct mislabeled students. So I hope that I've not taken too much time, and I appreciate your allowing me to speak.
Representative Dry?
Thank you, Mr. Chairman. Just a little bit along that line, Representative Damon and Bricky and I went up to tour the North Country to talk about, because SAU superintendent invited us up just to see their area. And we sat with principals, we sat with superintendents, we sat with board members, and we toured that district. And just to kind of paraphrase what I got out of that from him was that in an area like that, consolidation is very difficult just because of the expanse. But regionally, things could work, and there is already kind of regional cooperation. Special ed was one of the places where, instead of every district getting services from one person totally independently, for that particular district to share some of those resources. He didn't have an idea how it looks, but that was the idea of where they thought if they had to consolidate, that would be their first step.
Who was next here?
It's a Representative Live. Or just take Vice Chair Ames, sorry. And then I'll ask my question.
Yeah, I think I first want to say that I think this question of consolidation is a big question, and that I fear that veering off to try to deal with that in the special education context will be just one more trouble for us as we try to get to something that's constructive and that does something in the near term. And then the other point about consolidation I'll just make is that a core idea with special education is integration of special needs kids into the mainstream as much as possible. And maybe when we talk about high cost, high end students, we sort of lose track of that because those kids may need a special placement and may need a more regional approach, but a lot of the kids in special education are part of the local system, and any kind of movement away to a regional system will fight against that, I think. So I'd be concerned about that, and that's a concern that I think relates to this larger issue of what should be consolidated or not. And I'm fearful that would be doing a U-turn in this effort.
Okay, there's 3 of you have your hands up right now. Work right around the table here. Okay, Representative, Dr. Dolph.
So I think there's consolidation. It sounds like there's 2 different forms. I mean, there's effective collaboration. Like in Massachusetts, they have collaboratives where services are provided in a regional way. This sounds more like you're talking about the administrative structure, right? Mm-hmm. And I think people are fleeing the field right now. So having worked as a director in 2 of the biggest cities in the state, good luck finding folks to work as a regional special ed director because it's virtually impossible to even imagine doing that. You're really working with so much detail and data for each student. Nobody is identifying students to try to get additional funding. The entitlements are so far on the other end. It costs so much. But districts obviously do the important work. There's no incentive to identify a child or keep them identified. I can say that with perfect clarity. I also question the data that's provided. I don't know of a district that has 30% identified. I know that that's reported in many places. The district I work in has very high numbers reported, but I can tell you for a fact that those are not accurate. So I think there's a lot of The other thing is there's a safety valve. I mean, we've been talking about funding since 1910, but as far as the catastrophic aid or special ed aid or whatever we want to call it, the legislature determines how much of it they're going to provide, and they've been prorating it for decades. So even if your numbers are off and it costs too much, the legislature is simply going to say we're only going to do 65% of the 80 or 90%. So there's a safety valve in place should, it be too excessive in cost. So it's just a desire to either, stop downshifting costs from the state to the local taxpayers or not. And there are multiple ways to do that. I think the biggest travesty is really the disparity from district to district and the ability of districts to provide services to students with disabilities depending on where the child lives based on their zip code.
Yeah, the proration this last year was 90%.
It fluctuates, yeah.
And it does fluctuate.
Yeah.
It goes down as low as 68% and as high as 90% or
Right.
maybe 100%.
Right.
Representative Murray.
Thank you, Chairman. I just wanted to also make a comment that to Representative Ames's point, I think, yes, it's a core tenet of special education, but it is also federal law that students are afforded the opportunity to be in their schools in their local communities. And I think Dr. Doloff was also stating that there is an opportunity to consider different types of consolidation. And I'm curious whether we're talking about administrative consolidation or student consolidation or services, aggregating services. I think those are three very different things. So I
The
agree.
program I was talking about was not an SAU consolidation, not mergers. It has to do specifically with providing the service, the training and the advocacy for and the managing of providing that speech or that physical therapy. That's where I thought it'd be a wise place to start with a program rather than saying we're going to consolidate SAU 23 and 25 and 26 into one region. I think that's where we start running amok.
And to be clear, that's what I endorsed as a great first step. That's what whether you want to call it that or not, that's what I would endorse in this here.
And which one? I'm sorry, can you expand?
I endorsed looking at operating the administrative cost of special education at a regional level, which is what I heard the chairman suggest.
Yeah. Okay, it was coming around the table here. We had Representative Dry and then Representative Freeman.
Thank you, Mr. Chairman. And that's the impression that I got from there. There was never any talk of consolidating students. It was resources of providers.
Representative Freeman.
Thank you, Mr. Chair. And to speak to Representative Ames's point, that SAU consolidation bill was no attempt to isolate any of those children that have special education needs. We follow IDEA, and IDEA expressly states that those children must be mainstreamed. So if we did that, if we isolated those children with IEPs at 504s, then we'd be in violation of federal law and subsequently would lose the little bit of money that we do get from the feds to reimburse us for special education. So I would never support anything that tells us we must isolate any child.
The program that Henry Lippman was talking about is the one that you'll see there on page 2. The Colorado School Medicaid Consortium program is a nonprofit organization. Well, we wouldn't have to go that route. There's a lot of different routes you can go to navigate, implement, and maximize federal reimbursement through that program. It provides training, support, and advocacy to help districts manage billing for student health services. Taking that concept and boiling it down just to special education initially may be a way to try to make our program more efficient, but also still provide the services that we expect that we provide in every school, in the least restrictive environment. Becky Wilson.
I don't quite need that leveling up. Thank you.
You don't need it either.
You know, it's $100 you love that, dude.
I just wanted to make sure, Chairman Ladd, that you are aware that we do have a New Hampshire Medicaid to Schools Resource Center that is already up and running here in the state that provides resources and implementation of school-based Medicaid to Schools programs, one-on-one consults, collaboration. I believe they testified in front of I don't remember it quite honestly, with one of the House Education Committees this year on a Medicaid to Schools bill. They provide an extraordinary amount of support to districts that seek that out to try to help them implement the Medicaid to Schools program consistently. And just a little reminder that Medicaid to Schools is undergoing an enormous sort of renovation, I guess I'll call it currently, where that's going to change how all of that is happening at the district level, like right this very minute.
So I think we talked about this early on. The state had a sort of self-imposed injury where we made it so difficult to bill for Medicaid that districts have lost millions over the years. So, I mean, going back and rectifying that would be one step in stopping the downshifting. But Medicaid is not going to get us out of this. Districts are so far down on Medicaid and what they anticipate getting.
And that Medicaid report is attached. There are 174 schools in that MTS right now. That's in the report that was sent out to Senator Carson and Representative Packard.
Thank you, Chairman.
And that came out January 29, 2026.
Correct. And I believe that they are able and willing to meet with individual school districts. They run monthly Medicaid to Schools collaborative meetings. They will help you get hooked up with other professional associations, things like that around Medicaid to Schools. So that may be a resource that perhaps wants
So
to be
when
included.
I need clarification on this because I'm not really aware of what's going on here a whole lot. But if you have 174 schools that have been recognized as providers, what's that mean?
Thank you for the question, Representative Ladd. I'm guess who is saying that there are
Well,
174
it was
providers?
in this report, and there was another wad of paper which had all the list all those schools that are part. It does on the last page a list of the 174 school districts and school administrative units enrolled as Medicaid providers during this period is included.
That tells me that those are the districts that are participating currently in Medicaid to Schools. That's it. The ones that are doing it. That's
So when they talk
simplified.
provider, they're not talking about a person that signs off on delivering a PT.
No, my understanding would be those are the 174 districts that are submitting claims to Medicaid to Schools.
Okay, the word provider threw me. Okay, were there any other hands up on this one right here? So tomorrow I think it's in the, I don't know if it's a morning meeting, Representative Ames when they're meeting, Finance?
Yeah, it's tomorrow morning.
Yeah, because I have another one in the afternoon, Legislative Oversight Committee. So I think would behoove some folks to maybe tune into that or what's going on here. It means where they're going to go forward with one of these amendments or maybe a version thereof. It's something that seems to be moving pretty quickly here. Perhaps,
They have about 25 bills on their
Yeah.
exec session tomorrow. So it starts at 10 o'clock, but I have no idea what order they'll take those in.
you can see the list. It's way down on the list here.
I'll be there all day.
Okay.
I'll keep notes.
So as a group here, are there any people like to be on a small subcommittee where we can pull in the commissioner, the director, and sit down around a table and start talking about some of the issues dealing with Nessus and the reporting and see what available data is there for us and how can we arrive at some potential of what costs we're talking about? I've done it before with people out of that department. I've done it with Brian Eaton. I've done it with Mark McNeilany, and who's on the finance side. But they're also speaking on behalf, and they have a new analyst over there in special ed right now. I don't know his or her name. But
So the focus of the committee, of this little small group?
that first conversation we had today,
Yeah.
to try and,
Understand the Nessus 2.0 stuff
yeah,
and the information aggregation.
yeah.
I'd be happy to.
You see, I'm concerned that we're not getting down into what the individual IEPs do not have costs written in them. They may have associated with it when they're written and after they're approved, but you're not deciding that at an IEP meeting. You can't touch that,
Right.
nor should you. That's right. So we're looking at aggregate average costs And that's not going, we can figure out average costs easy.
I think. I was going to say, I think in one of two paths. I think for the benefit of this entire committee, they could come before us and we could have that discussion so that we can all hear that, I think, and participate and ask questions. I honestly would say if whoever wants to show up to such a meeting, it should be here.
I think that if you really want to get all the information, you don't do it at a large meeting. You take a small group where you can sit down and just open it up and drive the conversation, and then bring it back to the whole committee.
Can I ask a clarifying question?
Yeah.
So the purpose of this would be to determine what the costs would be should one of these amendments pass, correct?
Yeah.
Is that why we're trying to delve down into that data? I mean,
When I talk to the folks that are on my committee, they're all, 3 of them are MIT graduates, so they're supposed to be brilliant. And they all have a different answer. And it's like talking to lawyers, you can always get a different position.
yeah.
And that's what's going on. Everybody has a different scenario for what the spreadsheet's going to look like. There's some that coming out with numbers, and others are coming out and say, you can't do that. So I think we're going to come up with the same answer. I don't think we have the information available to give us the numbers right now. We've tried on the House side to do that. Rebecca.
Can I ask a
Becky?
clarifying question? The small group meeting is to talk about the data collection system or to try to actually get costs?
Both.
Okay. I mean, I wonder if there wouldn't be any tolerance to having some sort of a work session as opposed to a commission meeting, to Representative Murray's point, where we could come up with the questions that either the small group could bring, or maybe have some people from the department come. And I mean, Rebecca Fredette is on this commission, so maybe give her the questions ahead of time that people might want to have and see if we can get some answers. I know she's provided quite a bit of information as well in response to that document from January in terms of what information is available. She provided on 12/23 a pretty extensive.
I think you need to
List.
go beyond just the policy side. I think you need to have the financial analysts there as well. And
don't
for
disagree with
everybody
that.
to break loose out of DOE to come over and sit through another couple hours when they're overburdened already, it's wise to just take a few, go over the sit around table, and we've done that. The whiteboards on the wall, they've thrown up examples and trying to find different formulas. That it's just a work session, a small work session, which you can try to bring back something to the whole. I've done that many times and brought stuff back, but it seems to always have a glitch. You know, I would take somebody like Representative Ames, who has a good understanding of where all this comes from, but also the data side of things. And try to really whittle down and get this information if we can. If we can't, then we're just going to have to identify some kind of a formula that backs this thing off and see what the consequences are in another year. And it's just like when we had in catastrophic aid several years ago, $34 million. We found out it cost $16 million more than the 34. That's probably something we're going to have to experience again.
I would be happy to be part of any of those conversations, unless you're simply looking for legislators on this committee to be part of that, which I would also completely understand.
And I'm happy to be there to take notes and then.
More than that, you need to contribute your 2 cents there.
Thank you.
Yeah. Okay, I'll try and put something together, okay, where we can,
It's your discussion.
yeah. Okay, I'm jumping on to some other topics right here, right now. We have another number of responsibilities in SB 57, which we have to tackle here. And in looking at under B, the state of the state, there's a sheet which you have there. It's like the third one down. It looks something like this,
Yeah.
Oh, yeah. Yep, seen it.
okay? New Hampshire's identification rate is high and climbing, 19%. The state school identified 19% of their students with disabilities. This is considerably more than the national average of 16%. I find that hard to believe, but I didn't do the numbers, so. In the middle column at the top, learning disabilities are the most common disability type in New Hampshire. Learning disabilities, 35%. Other health impaired, 20%. Autism is 12%. And speech, language impairment, 10%. And the remaining are 24%. So there's been questions before whether we over identifying. Rebecca, Becky?
I would just want to remind the commission members that every district does get a quote unquote report card each year on indicator data. There's 15, I believe, 17 indicators, only special ed related, that talk about the rates at which students are identified at the local level. Everyone can look it up for your own districts. And it will, if districts are over identifying, there is a indicator for that, and districts need to put in some sort of corrective action if that is the case, or be able to articulate why perhaps it's higher on a given year. But that happens every single year, and every district is evaluated in that way.
Who does the evaluating? Who does the going and visiting and saying, this is occurring, you need to correct this?
It's based off of the NESIS data. It's not about a person going to the district. It's through the Department of Education. It's in the iReport information. You can pull that for every single district. And on that resource sheet that was sent out in January, there is a link to those reports if anybody wants to look at them, that I had sent to both you, Representative Ames and Jennifer.
Is this all done by way of paper that's received or data that's put in, or is it a result of a staff member going out to the district and observing what's going on, as we might see with the LBA report?
Again, disproportionate representation is pulled from the NESIS data. That's why I think we are repeatedly going back to, there's a lot of information in NESIS, and that's how districts are being evaluated currently. If there's
Right.
disproportionate representation in specific disability categories is indicator 10. You can go to the Department of Ed, you can use this link that is in this document that I had sent out that will tell you exactly how your district is doing with that indicator.
Representative Freeman?
Thank you. And thank you for that information. Just, is that also broken down by grade level?
Thank you for the question, Representative Freeman. I don't believe so because it's looking at district level indicators. However, you can drill down on some of those numbers, and I'm sure you could look at that.
Thank you. I'd want to pass it down by grade level.
Yeah.
And I just wonder, I think I just want to make sure that we're staying focused and clear here with, I thought our intention was initially to look at district aggregate data, because I understand Representative Freeman's point maybe that it would be nice to get some of that granularity, but we need to, for our purposes here, it needs to be a 30,000 foot view, a bigger picture, the sort of metadata kind of concept of what's happening. So if we can get those pieces off of the NESIS back end or it's there on iReport, I mean, I think to that end, Chairman Led, I think we should be able to get some of that in a digestible format.
If you look back 10, 15 years ago and look at the number of IEPs which we had in the state, it's not a whole lot different than it is right now. But our enrollment is significantly less. I would ask the question on the bottom on this sheet right here. It says special ed costs are mostly labor. 27% are teachers, 26% are specialists, and 47% are paras. If I went back those 10, 20 years, would these percentages look the same? And if not, why? Becky?
This is my personal narrative observations. The key to identifying students appropriately, in my opinion, is strong regular education programs with good differentiation. Because if you have strong, I hesitate to even use this word because it's going to take us down a bad road, but tier one, if every kid has access to really strong education programs that are able to accommodate different learning styles, flexible ways of answering, showing what they know, then the students that rise to the level of being evaluated for special education, by the time a student is evaluated, teams should be fairly confident that they have gone through a process of weeding out whether it's just a mismatch of educational style, whether they just don't get algebra, or whether they really have a math disability. Those kinds of things have been weeded out because you have a really strong general ed program that is able to meet the needs of most of your students. If you don't have that, a lot of times what you end up with are kids who quote unquote need help. And if you don't have a district that has the resources to provide help to lots of kids all the time, depending on what you're doing, the only way for them to get help is to funnel them into a system where help is mandatory. And for most of our districts, that's special education, because you can't say no. If you get to the point where you've identified a student and you require them to need help and you have no other resources available to all kids, then you're going to get them to a point where they can get help. And that help sometimes looks like a person. If you don't have teachers who are well versed in differentiation, for example, they don't know how to lesson plan that adjusts the accommodations for lots of different kinds of learning styles, different needs, they're not able to be flexible in their teaching, then a lot of times you end up with students who need a paraprofessional because that person is modifying what's happening on a as-you-go basis in the moment, or you have somebody who can address that student's behavioral needs in the moment. And I think that we spend a lot of time talking about special education and how much it costs and all the people and things like that, but we don't tie it back into having a strong regular education program, because that is your number one best antidote to wrongly identifying, or to Senator Murphy's point, potentially labeling students in a way that's not really representative of who they are as a learner, but more representative of the system.
If I could just add to that, we've started with a multi-tiered system of support for a long time now, and so in some districts that have resources, you have a much more robust tier two. Tier two is not special ed. Tier two is services that kids get outside the general ed potentially class by interventionists. In districts that don't have the resources to have a robust tier two, you've got to go directly to special ed to get additional supports. So it's really, it's really a complex mix of different needs. You've also got, in some districts, more affluent districts, parents are stronger advocates in many ways, and higher advocates and attorneys and so forth. So there's a whole bunch of different things playing a factor, but I don't think the identification rate has changed dramatically. The other thing to keep in mind is that we also provide services to students, sometimes in private facilities, but in charter schools as well. So that keeps the numbers high.
See, none of this is really answering my question, though. My question was, why do we have to have 47% of our labor force costs be that of paras? We had students that had different learning styles and teaching styles required back 20 years ago, too. We had some of the issues, I'm not saying all the issues, but we had families that had problems. There were children were children back then as well. But I can recall as an administrator back in the 70s that we did not have as many paras. I maybe had more resource type teachers. The teachers are the ones that identify, not the para. The teachers identify that they are the ones that are recommending to an intervention process, whether it be tier 1, 2, or 3, or the intervention process you may have within a school. They bring that name forward. A parent can bring it forward as well. But the answer is, are we going to then set up where we're going to have, well, this child needs a para now. Maybe that child needs more teacher time. Maybe that child, rather than staying in the room for reading, would come to a reading specialist or a teacher that can teach reading at the level and in the way that that child needs, rather than having 4 fourth grade classrooms and 4 paras in 4 classrooms and having 1 resource room teacher where the kid can go outside. And you know what I'm talking about.
So those are the costs. I think
That's
a
what I'm talking about. I'm talking about costs.
a more accurate measure would be the number of paras. The cost of hiring a para has changed significantly. We know that contracted services now play a big role. It's harder and harder to find folks to come into the school district and work because they can't earn a living wage as a para. So they're going through contract agencies. It's just a different. But I think I'm not disputing this. All I'm suggesting is 47% of the cost is paras, but is that because we're now hiring more through contracted agencies, which costs double the cost of a traditional para?
And I'm not knocking paras.
No, I know.
But what I'm trying to look at is the teacher is the one that comes equipped with the background, the education levels that demand the type of instruction occurring in the room. They're the ones with the skills, the knowledge that they're to impart. The para may be somebody that came in that's just a nice person off the street that doesn't have any understanding of that subject area. Right. So, but the IEP now requires that child to receive this service as being delivered by a para that's not certified in that area.
Right.
Representative Murray.
Representative Murray.
I'm just sorry. Having been in the classroom as an educator, I would beg to differ that as the general education classroom instructor, that if there is a one-on-one para assigned to a student, I am still or had been providing the direct instruction or group model or whatever it is to the student. The para is simply there to help the child. They are not doing the sole instruction. They are helping facilitate the needs as they're defined under the IEP. So I want to be very clear there. There's 2 different things happening that you're talking about. And so while yes, I understand that number is high, that is the facilitation of services that are happening in the classroom. And to Becky Wilson's point, Ms. Wilson's point, when we talk about what the needs are for differentiated instruction models, strong classroom management and differentiated instruction is a tool in the regular ed classroom to help having interventionists that are tier 1 or support specialists, those people who are pushing in and pushing out, whether they're doing pullouts or push-in, that happens all the time. And so if that portion is well and adequately funded, there should be less of a barrier and a need for those tier 1 interventions, tier 2, and then perhaps lessening the burden for special education IEPs or 504s.
I'd like to, and then I'll go to Tim in a second, but New Hampshire special education programs are more staff heavy than the national average. New Hampshire special ed programs employ 1 full-time equivalent for every 2 special ed students. Those are significant numbers. And was it like that 10, 15 years ago?
No, it wasn't.
What is going on here to drive these costs so high? Tim?
Thank you, Mr. Chairman. I think part of my experience comes from the families I work with, but also my wife is a teacher. And I would say behavior is a big piece of that. We use paras as for behavior. We contract with RBTs, with private companies that do cost more because we see more behaviors than ever. A large portion of what comes to me involves behaviors. And I know there is no silver bullet answer. I would say that, we have seen some increase in diagnosis and recognition of autism. Autism almost always brings an RBT with it and a BCBA. And so those types of diagnoses bring along some providers. And I do agree with Dr. Dolph that the outside contractors are very expensive. By no means am I knocking them, and are they not necessary? They are, but there's more costs associated with that. I don't know what the answer to behavior management is. The other piece that I would say some of these come from, the increases come from, is that there's a heavy focus in the family courts now. Step one in a proposed order is if you go down, as this child must be evaluated for special ed. So every time that there's a court involvement with DCYF, that whole process has to happen. I'm not saying all those kids get identified, but a lot of them do. I know I supplied you with some data directly, and it surprised me when I looked at OHI, because one of our mandates is OHI being overdiagnosed. And what I was shocked to find out was that as I went through the cases I've worked on where OHI is there, most of them have co-occurring disabilities, OHI and emotional disturbance, OHI and autism. But the high prevalence, and I say 80% prevalence of trauma in those child's lives, I didn't expect to see that. And it came up, and I just completely blind study did it. So I don't know if that's contributing to it, but I will say that where I see paras used a lot, and I agree, it's a lot, it's behavior management a lot of times. And I think it's a bigger issue than just school. We have a behavior management issue that's trickling into lots of places.
The OHI information you sent me is right there on the first page.
Oh, I'm sorry. I didn't. But it was kind of shocking to me to see that much trauma.
If I could just, and this is not, as Becky said, this is my opinion. I think that the system is a system under duress right now, public education, not in just New Hampshire, but elsewhere. I think that we're dealing with students with a lot of trauma, a lot of emotional needs, the rate of anxiety, medication for attention deficit disorder is shocking. I think that we've put, and this is an opinion of mine, too much emphasis on test results. So the pressure is, and now we're posting them when we're going to vote at school district meetings, the pressure on the general ed teacher to change those test scores and to fixate on test scores has really had a profound effect on public education, and I think leads to a lot of students not being able to manage as we push and push and push with rigor and try to drive those scores up, when in fact those are not necessarily valid measures of students' abilities. It's a group administered assessment that doesn't serve the child necessarily, but that's my strong opinion.
I would also just add to remind the commission that the diagnosis or the label of other health impairment in terms of the deliberations for that identification, the criteria that students need to meet is much low. There are less benchmarks in order to be identified under that category than there might be in some of the other categories. And I think in that document, I've attached examples of all of the deliberations page. Again, those are mildly different in different districts, but the criteria are set under the special education rules. So those are all the same. And you can go in and look at those and see what a team has to determine in order to identify a student under that category. I will also say from a experience narrative standpoint, have some of the things that Tim is talking about in terms of trauma, in terms of students with challenging behavior, with students with mental health needs, things like that. Identifying a student as other health impaired sounds very different to a family than identifying a student with a serious emotional disturbance. It sounds very different than telling a family that their student might have autism. It's a category that, for those of us in the field, that once you're identifying a student, the label isn't really the focus. The focus is on what's in the IEP and what the student needs. It's the gateway to that.
Right.
We're not focused necessarily. There are times where, for sake of collaboration and kindness and moving forward with families and students, the label is not the focus. So if other health impairment opens the door to us being able to provide students with a really appropriate program, we're going to use that to some extent because it is a kinder conversation with families. And over time, maybe that changes. Kids' needs change over time. A 6-year-old looks a lot different than that same student looks when they're 12, when they're switching from the elementary to the middle school. It doesn't mean that teams haven't, repaired the special ed need. It's just the needs change. As kids get older, their needs change. So I just want to be cautious about the fact that we're not just sort of, saying people are using this label to sort of, just haphazardly go through this process. I think there are intentional reasons that is used as a category, and maybe why some of those categories are used more frequently than others. I'll leave it at that.
Becky, do you know if the department captures information regarding how many students in each school in these 13 IEP categories, looking at the trends of the number of kids in each category, whether they're going up or down? We see it as an aggregate for the state. We can go back and look at that. We've got that information. But do we have that information for the individual districts,
Yes,
schools?
yes.
Okay, we have not been provided that.
It's collected, and any district could provide you that. Any special education director could give you that pretty much off the cuff, because it's something that they use quite frequently or ask that question. But yes, it's also collected at the district level by the department.
And do you know of any districts where you might see in a particular IEP area over the last several years it's spiking, and does the department make a visit to that school?
Thank you for the question, Representative Ladd. They're not visiting because there's a spike in that category. The assumption is that the IEP team is appropriately going through the deliberations to identify that student. So again, unless somehow the legislature wants to have access to every single child's individual evaluation deliberations pages, which I don't think you're asking for, those deliberations are what the team is doing in order to appropriately identify or not that child and determine what needs to be included in that child's IEP, assuming they are evaluated and identified. The reason why a team might pick other health in one case and autism in another case, or serious emotional disturbance for anxiety versus other health for anxiety, those are very individualized decisions based on individual students and their needs. I think that's the whole point of special education, is that it is individualized. We don't want to be making these blanket decisions just because you might have more kids one year that are other health and next year you have more kids that are LD. That doesn't mean anyone's doing anything wrong. It also, there's a lot of factors about things like developmentally delayed. You can only use that category up to a certain age. I think it's 9 years old. So when students turn 10, which for most kids is around 4th grade, you might see a spike in your LD category, for example. And that's because students who previously were under developmental delay have to be identified as something else after they turn 10. So you're trying to vet out what category is the right category. So maybe that year you had 3 kids that were, I gotta move that, I keep knocking over, that were developmentally delayed. And now you're determining, okay, this one's going to speech and language, this one's also going to speech and language, and this one's going to LD. Like, that might be the reason. But again, unless something's coming up on your indicator data, which would represent a really systemic issue, which is why we have indicator data at the district level, so that departments and district directors can look at that and say, oh gosh, we have a problem systemically. Like, that's why that we have that data.
My question, though, is getting to the issue, does the department get into the schools to oversee or to look at these programs? I know they're not doing it for the minimum public school to see if the schools are meeting the minimum public school standards for approval. They're not doing that anymore. They have a staff that's looking at federal programs, the paperwork that's submitted. Do they have the staff that's necessary to go out into the schools and look at curriculum, look at how instruction's occurring, which to me, that's more important than looking at a piece of paper that floats in saying, my achievement score is this.
Thank you for the question, Representative Ladd. I will say for certain of indicator datas, out of the 17 indicators, there are audits that are done for transition, for example, to make sure that districts are appropriately including the right things in their students' transition plans and their IEP. And if every so many years, districts are audited on that, and a team from the department comes in and audits your IEPs and pulls a random selection and looks at it and makes sure that you're doing it correctly. There are some of those indicators. They don't do it for all 17 indicators, no. But I'm not sure what indicator you are concerned about off of this list that would trigger some sort of department
Well, I
audit.
was looking at if you had an area where over a period of years it was spiking, would they then visit to say, okay, what's going on?
You would get dinged, for lack of a better term, at the district level for disproportionate representation in a specific disability category. That would show up on your indicator report card. And yes, at some level, there's technical assistance that would be provided. Jen could probably speak more.
Yeah, I used to do this when Ceresco was the agency hired to
Yeah.
go in and do these. It's very hard. I mean, program approval would go in and look at programs. The state, I don't know that the state has the capacity.
That's what I'm looking at.
They're short-staffed often, but getting into every district and analyzing curriculum decisions and who's being identified, even hearing officers will defer to the IEP team and their determinations. As far as paras and decisions regarding support services, every district I've worked in has a protocol that requires you to go through steps to determine whether or not a paraprofessional is appropriate. The 14 disability categories require that you go through a discussion about whether or not a student's eligible or not. None of these decisions are made lightly or without structure and systematic, systems in place. I would imagine to be challenging for the DOE to go in and make decisions as to whether or not curriculum and programs are appropriate or causing an increase or a decrease in student disability areas.
Person Murray?
Yes, thank you. And to the point, and to Senator Murphy's point, when we were talking about whether or not students stay in that sort of cohort forever, there is a yearly opportunity for special education teams to get together and decide whether or not the student has made adequate progress towards that need. And if they have determined that that is no longer a need, a service will come off of the IEP, or something new might come on, or they might leave the IEP altogether if adequate progress has been made. So, and I know that from personal experience with my own kiddo who needed services when they were little at a 2.5 year in the early stages. And so access, as you know, with those younger kiddos is crucial. So I think that does happen.
Senator?
I don't see the point of back and forth here, but I also have personal experience. Same sort of situation, I'm sure. And it's quite, what I've seen with all three of my children is the day comes that you sit there across the table from 5 people who all say, well, we've seen a lot of progress, but let's leave this alone for one more year. And we'll sit here next year and maybe then it'll be a better year for that. Let's let it go for one more year and see what happens. And so I have felt a lot of pressure as a parent to not argue with that and to allow that to continue. Of my 3 children, well, I don't want to get too personal about it, but it's not as easy as just saying, oh yeah, we're great, we're in great shape now. Great progress can be made and still have to sort of fight to get off that IEP or that special education label. Thank you.
And I think a lot of us have had these personal interactions. And I, for one, was there when a youngster in our family had a IEP in speech. And the speech services were being provided twice during the month by a certified speech teacher. The other contacts were made by a para, hired to interpret what was in the IEP and convey that service. So, my concern is boiling down to that last on the sheet you have in front of you, looking ahead. Given New Hampshire has some of the most heavily staffed programs in the nation, one option is to focus on quality over quantity of staff to better support learning while containing costs. Are we better off putting more of our dollar into the teacher than into the para? And are we going to be satisfied in making a recommendation at the end that 47% of our labor costs are paras? Is that what we're going to endorse
I guess
as a commission?
clarifying question. I mean, these are these are funded by local districts, all of these supports. So I'm not sure, I mean, we're going to legislate how folks do things at the local level as far as, meaning, how would you impose quantity over quality or quality over quantity?
We have a response to provide all children in this state the opportunity for an adequate education. And that means that on some of these issues where we are, yeah, we're not funding the bulk of the cost for this. This is coming from the local, I get that. But that doesn't make it right that we're not providing the type of service that the child deserves through a para.
It's very clear. The state rules are very clear about when a para can be utilized. A para cannot be utilized for direct instruction. So a para can be utilized, for example, to go over lessons a student's already learned. I don't see that as being a big issue unless this is something I'm not aware of, that paras are being utilized inappropriately to provide services and direct services in content area. Is that the question I think that we're putting on the table?
That's part of it. Yep. Becky?
I guess I just want to clarify this point that says that New Hampshire has some of the most heavily staffed programs, and so the focus would be on the quality versus the quantity. The quality of the programs, is that what this is saying? Because a person is not a program. And a
service.
a paraprofessional is not a program. A teacher is not a program. I mean, paraprofessionals are used in the best case scenario to carry over strong programs. That's why they're with the students for a good part of their day, most of these people, is because they are carrying over programs throughout the child's day at a high level of inclusion. So I think providing more training to teachers, are you talking about just special education teachers, regular education teachers? Are we talking about making sure that all of our teachers are licensed or trained in a way that they are providing a strong program? Or are we talking about making sure our paraprofessionals have access to more training? I don't understand what quality over quantity of what.
You go to that second column, the middle column there, where it says the percentage that are in certain capacities.
So I guess my question to you, Chairman Ladd, would be, in theory, if this carried out and we had more quality training for special education teachers, in your mind, would that shift the ratio from 47% are paras to 47% are teachers and 27% are paras? You know, like what are we trying to do with these percentages? There are many districts where, for example, co-teaching is part of their high quality special ed program. So there's a special ed teacher and a regular ed teacher in most classrooms. That would maybe reduce your need for paraprofessionals in that particular classroom because you have two highly qualified, very trained teachers who are co-planning and making all of those lessons together. So kids don't need to leave the room. But I think trying to just look at it from percentages without any other qualifiers in terms of, you know, what kind of paras are those, and we can go around in a circle, I'm sure, for hours about this, but, you know, whether or not the paras are just the classroom aides, or are they really special ed paras? Are they one-on-ones, or are they resource room paras? What kind of paras are these?
You raise a lot of good questions.
I just think, and again, I know this is not helpful whatsoever to the commission. However, when you're talking about special education being highly individualized, and then you're trying to take 30,000 individual decisions and boil them down to a one-page sheet where we're going to make a lot of assumptions, I think that flies in the face of what good special education really is, which is highly individualized, specially designed instruction based on every single child's unique needs in their particular situation. I think it's very hard to make a lot of generalized decisions based on that. It doesn't mean that I think we should throw a bunch of barriers into the mix of trying to provide financial relief to districts and local taxpayers about special education costs. Those are two different separation conversations, in my opinion. What are we doing with good special education, and how are we paying for it? Those are different things. And I think it's difficult to separate those conversations, but I think it's really necessary to do justice to all of the hard work that the legislature has put in this year in trying to solve special education aid and provide more relief to districts.
Further discussion? Yes, Representative Dry.
I have to leave, but the thing that you referenced that had a link in it, I don't recall getting, and I looked up and I didn't see anything in my inbox.
Representative Ladd, would you like me to resend that
Sure.
to you?
Go ahead.
Can I send it to you and you'll distribute it, or I need to send
Send
it to
it to all
everyone?
the members in the committee.
Okay.
Yeah. Okay, I think we've gone through and discussed many of the items on here. I will be trying to put together a small group to meet with the commissioner and some folks over at the department and bring back some information to us regarding that issue, which we talked first about. Is there anything else that folks may want to discuss today?
The only thing, I'm just looking at this memo, and it's the first I've seen of it, the Medicaid reimbursement annually and how it's decreased so much. I mean, I think that's certainly an area that the state could look at and figure out how and why. It's from the Honorable Sharon Carson to Sherman Packard.
Yeah.
Those were self-imposed issues. So if you look at it, I mean, those are millions annually that are being downshifted to local districts who can no longer bill for Medicaid because of the rules we've put in place.
Representative Freeman?
Thank you, Mr. Chair.
Dated January 29, 2026.
I'm sorry, Representative.
No, she was just.
To Mr. Olaf's point, we actually did have the Department of Health and Human Services here about the Medicaid to School programs. And one of the points he brought up is that because the DOE and DHHS don't have the computer systems integrated, they really cannot identify which children should be getting the assistance and not. So subsequently, there seems to be a lot of money left on the table by districts. So we did have that discussion with them.
So I was here for that discussion and I asked the same questions. So the districts are not leaving money on the table. The state has changed the rules. I mean, there are states that are submitting for 504 students. We've chosen not to allow Medicaid to come into this state for whatever reason. I don't know what it is. And we had that discussion. I think we also had a gentleman that used to run the billing system. But I'm just pointing to that as another cost that's been downshifted to local taxpayers because of policy decisions that get made at state level.
Okay.
Further discussion?
Thank you.
Okay, do I have a motion to adjourn? Okay, we have a motion made by Representative Ames and second by Senator Murphy. All in favor?
Aye.
Aye. Good. Thank you very much. Now, what I'd like to do, though, is we need to set up a time which is compatible to everybody else to meet next. What are the best days? Fridays, Mondays?
Fridays or Mondays work for me.
Yeah.
On the Friday. Fridays are good, but it depends. Sometimes I
Friday,
have a
as long as it's
morning.
not the last Friday of the month, because I chair the county delegation meeting.
Okay.
Sorry.
That's second and fourth.
I prefer Mondays, but I can do Fridays.
Okay, so
I can do-
we'll look at the calendar and see what we got. And I'd like to block something in here after we get the meeting with the people over DOE, come back and have a meeting. So I would say in about 3 weeks' time. Thank you.
Thank you.